Hi, thank you for attending Chief Marine Group's DBA SD Marine Benefits at a Glance. The benefits that we will be going over will begin June 1st, 2023 and go through May 31st, 2024. You will be enrolling in your benefits for 12 months if you're starting at the open enrollment. The only way that you will be able to make a change is if you were to have a qualifying event or a life event. That would be a marriage, a divorce, birth or adoption, death of a spouse, death of a dependent, loss of dependent status, or loss of spouse's job where coverage was maintained. You will need to present proof that the coverage was being lost, and you only have 30 days to make the changes. We have included instructions on the front on how to search for a provider for your medical, dental, and vision. You will have 3 Aetna plans to choose from. There are no out-of-network benefits. The networks are all the same at Aetna Select Open Access. You will have copays for primary care, specialist, emergency room, urgent cares. Please remember, a copay is the benefit that you would pay. Hi, thank you for attending Chief Marine Group's Benefits at a Glance. The benefits we will be going over will start June 1st, 2023 through May 31st, 2024. You will be electing benefits if you are starting in June at open enrollment for 12 months. The only way that you can make changes is if you were to have a qualifying event. A qualifying event is a marriage, divorce, birth, or adoption, death of a spouse, death of a dependent, loss of a dependent status, or loss of spouse's job where coverage is maintained through the spouse's plan. You only have 30 days to make these changes, and proof of a life event must be submitted. We have included on the front page how to find participating dentist, vision, and medical. You will have 3 plans to choose from. All 3 plans use the same network. You will have copays for primary care, specialist, CVS, preventive care, emergency room, and urgent care. A little housekeeping. Remember, copays are when considering your plan. Please remember that a copay is a fixed amount you pay for a covered health care service. Usually when you receive the service, the amount may vary depending on the type of covered service. For this example, the first plan has a $30 copay and the specialist is a $60 copay. I wanted to go over what a deductible is. The deductible is the amount you owe for healthcare services your health insurance covers before your health insurance begins to pay. So it's the first dollar you as the member will spend. Co-insurances, these all have zero co-insurance, but it's your cost share of a covered health. There's an out-of-pocket maximum. This is the most you will spend in a calendar year before the insurance carrier, Aetna, would be responsible for your care. Please remember, deductibles reset every January. You will have prescription drug copays for each plan that you choose. We've included information on RX. Just a reminder that your Walmarts, Winn-Dixie's, some Publix, GoodRx, there are some Canadians. You can ask your doctor if he has a coupon or she has a coupon. We just have to be advocates for our pharmacy. You will find that there are many places where we would be able to get discounts on our prescription drugs and not even use our insurance card. Also inside the benefit at a glance, we've included information just as a friendly reminder that anybody who's enrolled in benefits, we strongly suggest should enroll in the member website. From the member website, you can also download the app, but in the website, you will be able to find information and view your claims that were paid. You will be able to also download your access to your ID card. You can see your benefits and coverages to see how much of your deductible has been used, how much of your out-of-pocket has been used. Hi, I want to thank you for attending Chief Marine Group's Benefits at a Glance. The benefits we will be going over will begin June 1st, 2023 through May 31st, 2024. This is the time when you can go ahead and make changes to your elections with no qualifying. Thank you for attending Chief Marine's Benefits at a Glance. The benefits we will be going over will begin June 1st, 2023 through May 31st, 2024. You will have Hi, thank you for attending Chief Marine's Benefits at a Glance. The benefits we will be going over will begin June 1st, 2023 through May 31st, 2024. The only time you will be able to make a change to your enrollment will be if you are experiencing a life event. A life event is if you were to get married, divorce, birth or adoption, death of a spouse, death of a dependent, loss of a dependent status, or loss of spouse's job where coverage is maintained through the spouse's plan. You will only have 30 days to make the changes, and supporting documentation will be required. The front page also gives you information on how to search for a medical provider, a dental provider, and a vision provider. You will have 3 Aetna plans to choose from. Each one of the Aetna plans use the same network. They have primary care copays, specialist copays, minute clinic copays, preventative care copays. The first plan and the last plan offers you a copay for emergency room and a copay for urgent care. I wanted to go over what a copay, deductible, coinsurance, and out-of-pocket means as a friendly reminder. When you're considering your benefits, you will want to take into consideration your copays, your out-of-pocket maximums, your deductibles. A copay is a fixed amount you pay for a covered health service, usually when you receive the service. The amount may vary depending on the type of covered service. For example, primary care is a $30 copay. A deductible is the first dollar a member will spend before the healthcare insurance company, Aetna, will pay. So it's the first dollar a member spends before Aetna will start paying for any healthcare services that are covered. Coinsurance, all 3 plans are at 100%, but a coinsurance would be just that, a share of cost of healthcare services. Your out-of-pocket is the most you will spend in a calendar year before Aetna would be responsible for your entire care. Please remember that deductibles reset every January 1st. There are copays for your prescription drugs as well. We have included information as a friendly reminder that your Walmart, your local grocery stores, GoodRx can offer you discounts on your prescription drugs that you would not even use your insurance card. You can even ask your provider if they have coupons. We've included information on the Aetna member website. We strongly suggest that all members who are enrolled in the Aetna, that they should be registering as a member. From the website, you can review your plan benefits and coverage details. You can see where you are in your deductible or how much you've met of your out-of-pocket. You can review your claims. You can download a digital copy of your ID. You can find your network providers, including telemedicine, walk-in clinics, and urgent cares. You can get cost estimates before you get care. You can view and see the ratings of providers. There is also an app that you can download from Aetna. This is information regarding your member ID. Minute clinics. Minute clinics are at a zero cost share. There's lots of things and benefits that they could see. They can cover, these are a few of the items that the physician can go over for you and then be able to send, if you needed a prescription, directly to the pharmacy where you'll be able to pick that up. Aetna also has a virtual care solution at a zero cost share to you. There is also an Aetna perk being offered to all their members that is $100. It's given at a $25 allowance every quarter that can be used on CVS brand non-prescription health and wellness. There is information on how to download the catalog, how to register, and fastest and easy way to order. PearFit. There is a way for you to get healthy with your wellness and earn credits and points for this. You would need to create a PearFit account. You can choose a studio or a gym. You can reserve a class, show up, and work out. Dental. You have a PPO dental plan. If you were enrolled in this benefit last year at open enrollment, you should log on to your Guardian member portal and you can confirm whether or not you have been eligible for the rollover amount, meaning that the dental that you have $1,000 benefit could potentially be worth about $350 more. So that would be a $1,350 benefit for the price of $1,000. You get 2 cleanings in a 12-month period. You will, for certain benefits, be responsible for a deductible and then a co-insurance. There is orthodontic care for just children. There is in and out of network benefits, but we strongly suggest that you stay in network. Guardian has a very large PPO network, but you do have the choice of going out of network. VSP is the network for vision. You have a $10 copay. You have $10 copays for the office visit and for your lenses. There are out-of-network benefits as well, but as you can see that the allowance for them is not very high as a reimbursement. You can have frames at $150 allowance with a 20% balance as a discount. There is no additional discounts at Costco, Walmart, or Sam's Club and some of the private practices. There is already, these frames have already been discounted at these places. Contact lenses, also $150 allowance with a 15% off the balance. Again, no additional discounts at Costco, Walmart, Sam's Club, or some of the private practices. You will be able to see all of this information when you log into Guardian in your member portal. You can see networks. You can see the same thing with your claims. You can see how they've been paid out. You can see what you are owed. You are given an employee assistance program. You have up to 6 face-to-face meetings. You have telephonic counseling sessions. There's a 24-hour crisis helpline. EAP can help with financial help, legal services, online legal forms, child and parenting services, adult and elder care services. There are webinar and trainings. We've included the phone number and the website. Remember that the EAP is strictly confidential. Nobody will know that you have called in. This is strictly a private for you. There is a basic life and AD&D benefit. If you are a eligible employee, you could have a benefit of 1 times your salary not to exceed $100,000 and AD&D. in the event that something should happen. And also you have the ability to enroll in voluntary life and AD&D for you, your spouse, and your dependent. Additional information, of course, will always be found on Employee Navigator under helpful resources. But if you did not enroll in the voluntary life insurance at the time of your new hire window or when it was first being offered to you, or if you would like to increase the amount that you currently have, evidence of insurability will be required before consideration of the benefits will be approved. There is an electronic EOI where you would just fill out the information and it will be sent over secured. It is the quickest way to do it, but you could fill out paper if you wanted to as well. I would recommend doing it electronically. There is a short-term disability benefit that is being offered to all eligible full-time employees. It is 60% up to $1,500 maximum weekly benefit. There's an elimination period of 8 days for injury, 8 days for sickness. It is a 12-week benefit. LifeLock, you have 2 choices to choose from. More information can also be found on Employee Navigator under helpful resources regarding the 2 benefits where the differences are. But if you were somebody who unfortunately had somebody steal your identity, LifeLock will help you recover whatever was lost. If there was anybody opening an account under your name and Social Security, you could get text messages, emails, so that you could stop that very quickly. If you become a victim of the identity theft, LifeLock will help protect you with $1 million protection package. Tele-advocacy and healthcare navigation, financial well-being, and pet care. This is under the My Benefits work. There is a mobile app and a portal for you to log into, but for one payroll deduction, you will receive all of these benefits. These are discounts. You would use their network, and they would help you find discounts on pet care, alternative medicine. All Light Navigator will help you if you were to receive claims that you didn't understand. They could help you decipher and negotiate down if that's what you needed help with. They are an expert in that. There's a financial wellness, counseling, vitamins, MRI, CT scans. These are all done at a discount. You just have to work within their network. The All Light Navigator is what I discussed just a few minutes ago about how they can help you understand your insurance benefits, explain your care options, find highly rated doctors, analyze providers based on experience and cost. They can help you find ways to pay less for prescriptions, review medical bills, and resolve errors, assist with scheduling appointments, help with issues related to dental and vision benefits if you are enrolled in them. There's a lot it can do for you. These are the instructions if you were to enroll in those benefits to have the mobile app. Beyond Med was rolled out last year. This is a benefit that is offered where health insurance will not cover acupuncture, bariatric, chiropractic, dermatology, fertility, med spas. They do have a concierge office where they can call and help. You can call them and they can help you with setting up appointments. If you have a doctor that you would like to nominate, they can also reach out to that doctor as well. Flexible spending. This year for 2023, you can contribute up to $3,050 for the healthcare FSA and $5,000 for dependent care. There is a carryover of 500 of your remaining balance into the next year's balance. On Employee Navigator, under Helpful Resources, you will find information as to what FSA monies can be used for. We will be using Employee Navigator to enroll in benefits. If you're a first-time user, you will select Register as a new user, create a username and password, and provide your first name, last name, and the company identifier. It is case sensitive, so you will need to enter it exactly how it is shown on the screen. Next, you'll create a username and your password, and you will agree. If you are a returning user, you would log into employeenavigator.com, put in your username and your password, and then complete your enrollment. If you have forgotten your password, you would just click on Forgotten Password and follow the links. Please remember, all eligible employees must log on to Employee Navigator and enroll or decline in each benefit. You will know you have completed your enrollment on Employee Navigator when you get to the enrollment summary and you click on the Agree button. From there, that will close out your open enrollment. Please know that all your compliance documents can be found on Employee Navigator as well. Most people use their email address for their usernames. We have also included contact information for the medical, dental, vision. There's also information for reaching Colleen Hernandez at CGI or Debbie Rito at CGI, as well as your human resource, Janelsa Castella. We are happy to assist or answer any questions that you may have regarding your benefits, or if you just need help logging into Employee Navigator and Assistant and going through the process. I want to thank you for attending the Benefits at a Glance, and I hope you have a great day. Thank you.